Good afternoon, good evening, everyone. Thank you so much for joining us. We will get started in the next 2 minutes. Thank you. What is my video? Okay.
Okay, so hello everyone. Good evening, good afternoon. Welcome and thank you for joining us in the second in our series of webinars on the migration of nurses from Africa to high-income countries. Today we get to hear from nurses who have migrated to the United States, to Canada, and to the UK, tell us their motivations for migration and their experiences as they migrated to those countries. It's going to be a tell-it-all webinar where you get to hear details you would ordinarily not hear on any other platform. My name is Evelyn Amuako. I'm the liaison in Ghana for the Ghanaian-Diaspora Nursing Alliance. Before we proceed, I'd want to tell you a bit about the Ghanaian-Diaspora Nursing Alliance. So GDNA is a nonprofit organization registered in the United States and in Ghana. And our mission is to foster a sustainable local global collaboration between Ghanaian nurses in Ghana and the diaspora to advance nursing education in Ghana and to improve the health outcomes of Ghanaian people. Ultimately, what we seek to do is to significantly contribute to Ghana's ability to produce global nurses who are skilled and knowledgeable in specialty nursing areas and to improve health outcomes. Now I'll go ahead and tell you a bit about our panelists. I'm particularly excited about our panel today because it is a blend between the older generation of Ghanaian nurses who migrated and the newer generation of nurses. And so our first panelist is Martha Nugent from the United Kingdom. Mrs. Martha Nugent is a retired specialist cancer and palliative care nurse born and educated in Ghana. She started her nursing journey in 1976 at the Kolebu Nursing and Midwifery Training College. Mrs. Nugent became a staff nurse in 1979 and a midwife in 1981. She worked in the Children's Orthopedic Ward and the Neonatal Intensive Care Unit of the Kolebu Teaching Hospital until 1984. In 1984, Mrs. Nugent migrated from Ghana to the United Kingdom to join her husband. When she arrived in the UK, she completed the then adaptation course and worked at the King's College Endoscopy Unit for 15 months. In 1987, she moved on to work at Greenwich District Hospital in the care of the elderly ward as a registered nurse. She was subsequently promoted to ward sister and then ward manager in 1996 after completing her diploma in higher education. Shortly after, she became a practice development nurse for elderly care and stroke. In 1998, she embarked on a degree course in specialist practice as an associate student and completed the program in 2002. She worked as a community specialist and palliative care nurse until she retired in 2019. Mrs. Nugent is the current chairperson of the Ghanaian Nurses Association UK. Under her leadership, GNA UK has been awarded the Most Engaged International Nurses Association in the UK in 2023 by NHS England, the Chief Nurse, and the Florence Nightingale Foundation. She's currently coordinating a project funded by the Florence Nightingale Foundation for pastoral care to support internationally educated nurses and midwives from Ghana. Her special interests include teaching, church activities, nurturing, coaching, cooking, dancing, and reading. Our first panelist, Martha Nugent from the UK. Our second panelist is Faisal Adomako Duku. Originally from Ghana, Faisal started his career as a registered nurse. He gained valuable experience in delivering quality health care. He pursued a Bachelor of Education in Health Science and Bachelor of Science in Nursing, deepening his understanding of health principles and nursing practice. He taught nurse and midwife trainees in several nursing institutions in Ghana for about 9 years. Motivated to expand his horizons, Faisal relocated to Canada and obtained a registered practical nurse designation, continuing his impact in the healthcare field. Currently, he is pursuing a Master of Nursing degree at the University of Alberta, Canada. He's further developing his expertise in research, leadership, and evidence-based practice. Faisal's commitment to lifelong learning reflects in his dedication to providing exceptional care. Faisal aspires to contribute to healthcare policy research and education with a focus on improving patient outcomes and promoting the well-being in diverse communities. Through his unwavering dedication, international experience, and commitment to lifelong learning, Faisal Adomako Duku is poised to become a respected nursing leader, making a lasting impact on individuals and communities he serves. His research interest centers on palliative care or end-of-life care. Our second panelist is Faisal Adomako Duku. Now I move on to our third panelist, Dr. Daniel Apau. So Dr. Apau brings in experience from working in the UK and in the US. He's an acute care nurse practitioner in critical care medicine. He's an acute care nurse practitioner in critical care medicine and faculty at Lone Star College System in Houston, Texas. Interestingly, Daniel began by obtaining a BSc in administration from the University of Ghana before migrating to the United Kingdom, where he undertook training to become a registered nurse. Dr. Apau has vast experience in healthcare, including urgent care, primary, community, acute, and clinical care. He was a course director for the UK Resuscitation Council Advanced Life Support Provider courses and instructed nationally in the United Kingdom. He's a fellow of the Higher Educational Academy in the UK. He has particular interest in curriculum development and clinical teaching. Following relocation to the US, he obtained his postmaster's certificate in adult gerontology, acute nurse care practitioner, and doctorate in nursing practice. He's passionate about advanced practice nursing and inspiring the next generation of nurses Dr. Daniel Apau is the co-director of education and educational policy at the Ghanaian-Diaspora Nursing Alliance. Our third panelist is Dr. Daniel Apau. I move on to our fourth panelist, who is Angela Agore. So Angela is a registered general nurse and has BSc. Angela Agore, RGN BSc, is a senior clinical research nurse and a clinical trial team leader for Southeast London and Kent in the United Kingdom for a cancer research organization focused on cutting-edge clinical research. She also has experience working in the National Health Service, the National Institute for Health Research, and private social care providers in the United Kingdom. Angela received her Bachelor of Science in School of Nursing and is pursuing research in London. Angela has over 10 years experience working in nursing. She is particularly keen on improving nursing education and contributing to players and stakeholders to explore and improve upon the participation of Black, Asian, and minority ethnic communities in groundbreaking clinical nurse-led research. Our fourth panelist, Angela Agore. So moving on to our fifth panelist, Richmond Osei Bonsu. Richmond is an acute care nurse working in the telemetry unit at Baylor University Medical Center in Temple, Texas. He earned his Bachelor of Science degree in nursing from the Presbyterian University, Ghana in 2017. He relocated to the United Kingdom after 1 year of service in Ghana. Richmond worked for the United Kingdom National Health Service at Royal Bournemouth Hospital for a few years. During his time at the hospital, he worked in elderly care and respiratory wards. He mentored newly recruited internationally educated nurses from Africa to aid in their transition. Richmond is licensed to practice nursing in New Zealand and in Australia as well. He's a member and an executive member of Global Street Foundation, a non-governmental organization providing opportunities for street children in Ghana through education, vocational skills, and arts. His research interest is in nursing education, health technology, and age-related conditions such as dementia. In his free time, he African Osei Bonsu.
Great, thank you so much, Evelyn, for introducing our panelists for today. Good afternoon, good evening, everyone. Thank you so much for joining us for today's webinar. This is part 2 of the conversation on the migration of nurses from Africa to high-income countries. So why did we organize this webinar? So when we had the first webinar, we had asked folks to provide feedback. And one of the comments we got was that people wanted to hear from nurses who had actually made that journey. They wanted it to be more interactive. So we listened, and we are offering this second webinar so that you can hear from some nurses who have migrated from Ghana to the UK, Canada, and the US. And each of our panelists has a unique story to share, but we also want you to join in the conversation. So if you have any questions as they present on their backgrounds, please feel free to put the questions in the Q&A chat box or put a comment in the chat. We really want this to be very interactive. So I am Yvonne Commodore Mensah. I'm the president and co-founder of GDNA, the Ghanaian-Diaspora Nursing Alliance, and I have the unique pleasure of moderating our conversation today. But like I said, I really want everyone on the call to join in on this conversation. So we'll get started with some prepared questions for our panelists. So to kick things off, I guess I will ask our panelists to share their stories briefly. I know Evelyn did an amazing job of running through your backgrounds, your education. So can you talk to us about why you decided to move from Ghana to the UK, Canada, and the US? So perhaps we will get started with Mrs. Martha Nugent. Sorry, you're muted.
Good afternoon and good evening to you all. I'm sure reading my bio, you realize that I have been here for a very long time. And I came in 1984. I remember the date, 23rd of April, 1984. So next year will be exactly 40 years that I've been in the country. I came in not for greener pasture. I came in for personal development, joined my husband for both of us to develop ourselves. When I first arrived here, I thought, oh dear, all the buildings looked the same. People were not friendly, but I can't say that for all. Some people were nice and people wanted to know where you came from and why you were here. At that time, getting to do an adaptation course was not easy. It was difficult. But luckily, we had the opportunity of meeting a very good person in the Royal College of Nursing who was helping nurses coming from abroad to do the adaptation course. Unfortunately, some of us were not lucky. We had to do our adaptation voluntary for 6 months. So you can imagine coming to a new country, not having a lot of money, having to do adaptation for 6 months voluntary. The good thing they did was we were given a nurse's home. So we were in a nurse's home. My first experience in Hitchin Hospital was about a demented patient just enjoyed calling me her lovely nigger. And my colleagues thought it was funny at the time. It made me feel a bit uncomfortable. All that passed. I finished my adaptation and then came back to London to join my husband and worked at King's College for 15 months and then to Greenwich, as I've already indicated. The journey was not easy. The reason is because everyone is wanting to find out when you will be going back to where you came from and why you came here. Patients were not welcoming. Some patients did not want you to touch them.
Mm.
And I know it's still happening. And it's always, don't touch me with your dirty fingers. But when you work on an elderly care ward, you expect that. Initially applied for a medical ward. By the time, they were desperate for nurses for elderly care ward. So, well, I took the job and I don't ever regret taking the job on an elderly care ward because you learned a lot. Every diagnosis under the sun is elderly care.
Thank you for sharing that. And I'm sorry about the experience you had. We also have another panelist who moved from Ghana to the UK, Angela Agore. So Angela, what's your story? What brought you to the UK, and have your experiences been similar or different from what Martha has shared with us?
Thank you, Yvonne, and thank you, Auntie Martha. Good afternoon, good evening, everyone. Yeah, so I moved due to many reasons, but the main one was for career progression. I remember when I was practicing in Ghana, it got a bit monotonous, and I have a lot of friends in the diaspora, and we'll have conversations about nursing and what they were doing there, and I just thought to myself, oh gosh, I want to do, I want to experience some of these things. So, like I said, there were a lot of issues. There was a catalyst. I had a traumatic experience then, which was what actually catalyzed my desire to want to move, and then I made the move. I know people have different experiences. For some, it's particularly the finance aspect. For me, it really wasn't that. It was growth. I really wanted to be able to apply myself, and that was what really drove me to the UK. And when I got here, my experience is a bit similar to Auntie Martha's. If you do find yourself amongst elderly patients, they are not very welcoming, even middle aged. Depending on where you are, people may not necessarily be very welcoming. As for the comments and the derogatory statements, there are many. I'm not going into it, but like Auntie Martha said, you try to focus on what brought you here, and then how to grow and be the best version of yourself. And I would also say, when you come in, a lot of the time they put you at the very beginning of the ranking system. So even though you may be a senior nurse in Ghana, might have an advanced degree, whatever the case is, your qualifications are not viewed as par with the English one, and you are put with newly graduated nurses. And I remember coming in, looking at the work they did, and I thought, but this is a walk in the park. I mean, I can do these things with my eyes closed. But when you come from a third world like our country, unfortunately, your experience is not valued, it's not counted at all. And the fact that you may not be familiar with the systems and the devices and equipment doesn't necessarily mean, if you had a chance to learn about these things, you cannot pick up, but so these are some of the things. It's very difficult to be pushed down there when you're up here from Ghana, and being the smallest in the team when you were the biggest in your team back home. So it's a lot of the shock is very emotional. Auntie Martha has mentioned a few, but there's a lot of mental, difficulties that you encounter when you move, because you've passed your formative years. You are who you are. You what you like. We know the foods we like back home. We know the things we want to do back home, and then you come here and every single thing is different. And professionally too, you are put at the back of the queue, and you
Right.
have to figure out how to put yourself right back in front of the queue.
Right. There are definitely a lot of issues that you've raised. One is the discrediting or not recognizing the qualifications that you had prior to migration. So thank you for raising those points. So Richmond, you made that journey. You moved from Ghana to the UK, and then you found yourself in the US now. So walk us through your journey. What was it like working or making that transition to the UK, and then from the UK to the US? So what's your story, Richmond?
All right. Good evening and good afternoon to everyone. So the reason why, there are a lot of reasons why I moved from Ghana to the UK, but the main reason was after a year of service in Ghana, I thought I wanted to do something outside of the usual bedside experience. And soon I realized that there weren't many opportunities in Ghana, and the very few opportunities that existed, when I submitted my CVs, they were like, oh, you have a good CV, but you don't have enormous clinical experience. So I was expressing my frustration to one of my colleagues, and he suggested that, oh, why don't you rather move to UK? Perhaps you get a lot of opportunities outside. So I asked him what the process was like. So once he laid down the process, I realized that it wasn't difficult at all. So I just gave it a shot. So then 3 months later, after going through meeting all the criteria, the documents, I was in the UK. It was, in the beginning, you get into the honeymoon phase, you kind of enjoying the moment, but then reality will hit you when you get to the ward, my first experience on the ward, someone asked me, where are you from? I said, oh, I'm from Ghana, West Africa. And the first response was, oh, how come you speak good English? I was really taken aback, and I didn't know how to respond. So I didn't say anything. It was just an introductory phase. So I didn't say anything throughout the orientation that day until I went home, and I was reflecting on that. Because prior to me going there was a Nigerian who's been on the ward 3 months. So I thought, I mean, we're all from West Africa. She speaks English. So it's reasonable to know that anyone that comes from Africa working in an English speaking country obviously understand the English language. So the reason why I moved from the UK to US, so at the height of COVID, I worked in the COVID unit when the pandemic was at its height. So one moment I was thinking to myself that, do I have the luxury to actually take a break from work when I want to, because of the emotions caring for the COVID patients and the death that were coming as a result. But then I realized that the immigration process in the UK is not that favorable for people. So I started looking around to find places where the immigration process would be favorable towards me. That's why I have the New Zealand and Australian licenses as well. So I explored all those options.
Right. That's very unique that you're not only licensed in the UK, but you also are licensed to work in New Zealand. And you refer to some immigration issues in terms of challenges, and that's why you prefer to transition to the US, right?
Yes.
Yeah, so if you can elaborate in terms of transitioning from Ghana to the UK, you described it as very easy, right? When you made that transition, did you feel like you were well prepared to work as a nurse, and what was that transition like?
So moving, the process of moving wasn't that difficult. It was the adjusting to the system over there, because as Angela said, you are viewed as, basically they treat you as a newbie. You don't know anything basically. And sometimes you have the healthcare assistants ordering you around every now and then when you are new in the system, and sometimes you complain and you don't get any backing as well from the higher ups. And sometimes too, I remember one patient made a derogatory comment, and one of the deputies was like, oh, she was attributing it to dementia, like probably it's because of dementia, that's why the lady was doing what she was doing. And so when you get to the UK, so you get to do another OSCE, there's a practical exam you need to do aside completing the initial phases. So the challenge is that with some trust, you have to be preparing for the exam whilst you're working on the ward. So the difficulty of combining learning to pass your final exam and also dealing with the new environment, new health system is very, very challenging.
Right, thank you. Thank you for elaborating on that. So Dr. Apau, you have also made that journey in terms of migrating from Ghana to the UK and now in the US, but you're in a different position in terms of being a nurse practitioner. What's your story? What brought you to the UK initially, and how did you make that transition to the US?
Right. Good morning, good afternoon, good evening to our listeners, and thank you very much for joining us, having a discussion around our experiences as migrating nurses. So I moved from Ghana to the UK immediately. I completed my first degree, and that was purely for economic reasons. And obviously, once I got to the UK, the best option for me at that time was to train to become, a nurse. So in a way, I kind of stepped down, but I knew that, well, stepping down, you can always go up whenever you want. So as my bio stated, I trained and worked in the UK for over 25 years, starting as a bedside nurse, charge nurse in ICU. I worked as community matron, advanced nurse practitioner, clinical lead, resuscitation training officer, and then eventually I became a lecturer in advanced clinical practice at City University of London. And after all that, I decided to relocate to the United States, where I went all the way down working as a bedside nurse before eventually completing my nurse practitioner program to become an acute care nurse practitioner here. So obviously, historically, global migration and geographical mobility of nurses is more in line with seeking greener pastures and sometimes voluntary work. But the other part is, as Angela said, advancing oneself professionally. So when I was in the UK, I used to come to the US a lot. I went to Chicago, I went to New York, I went to several places, and I realized, the nurse practitioners there, what they did, and also economically, you go to the nurse practitioner. So when you think, oh yeah, so I decided to, come in here to advance myself professionally, and of course, you come here, you have to start right from the bottom. And if you are not careful, you probably end up there. But as later we share our experiences, once you are focused and you're engaged, you should be able to make it because of the training that you've had wherever you were as primary nurse.
Great, thank you so much, Dr. Apau. And actually, I see a question that's getting at what I feel Faisal will address. So Faisal, you migrated from Ghana to Canada, and your journey is a little different because education is what brought you to Canada. So can you tell our listeners what's your story? Why did you decide to migrate to Canada? And can you talk about the journey in terms of pursuing an advanced degree?
Okay. Thank you, Dr. Commodore. I greet everyone. It's afternoon time here in Canada. I'm currently in Ontario. My journey actually started, I wanted to actually go to the UK for school. And then I had admission from two universities. One was University of Bournemouth and the other was University of Swansea. But both schools, I couldn't secure full scholarship. I had academic excellence award scholarships, and for that matter, I couldn't get a tuition fee and other funding for myself. So I decided to look elsewhere to Australia. In Australia, I was able to get in touch with several supervisors. One of them was from Deakin University, whose research area was in line with mine. That was in palliative care. So he decided to be my supervisor. So he redirected me to BCIE, that is British Canadian International Education. They are in Accra. They serve as a local agent, and they will verify all your documents before they will give you final admission. And that got delayed from them. So by the time they got back to me, admission was over. So I decided not to go to Australia again. Then I had a student, I taught one of them. He completed in 2017. I started teaching nurse and midwife trainees at Nursing and Midwifery Training College, Kumasi. Most people call it Confanoche Nursing and Midwifery Training College, from 2013 all the way to 2022. So one of them who actually came here in 2020 told me that, there are good opportunities and offers here. He knows me, what I can do. So he would advise that I come to Canada. So actually, he helped me in the process of doing that. I applied to Canada, about 3 schools, and one of them I had admission, that is to University of Alberta. And I'm so fortunate that it is the best, currently it's the best nursing university in the whole of Canada. So I had admission, but I got visa refusal in 2021. So I decided to defer the program and apply for the visa again in 2022. Fortunately, I had admission and I came to Canada. I think my semester started on the 1st of September last year. I was in Ghana at that time due to flight issues. I got here, so whilst I was in Ghana, I was joining online. So I came here straight all right as a student. But when I got here, I realized that I cannot be a student alone. I need to get something doing to pay for my rent, to pay for my tuition and everything. So back home, because I was a nurse, I had to, unfortunately for me, I had a contact with somebody here, Bernard Mensah, who has been so helpful to me. So he told me the process to, take. So I had to start from the scratch, like a health aid. I was actually a PNO in Ghana, but I had to come and start as a kind of healthcare aid by writing a Duolingo exams. So, and I sent my credentials to them. So I had a ACA certificate. I started practicing at that time. But prior to my coming to Canada, I had already started the process of becoming a registered nurse in Canada way back in 2021. So when I got here, the assessment was ready. They gave me the report and they told me that I do qualify for the RPN. In Canada, they do have the RPN and they also have the RN. If you had to compare it to Ghana, it will be the RPN will be the diploma and the RN will be the degree. So because they said I don't have a Canadian education yet, I wasn't qualified to do the RN. So once I'm done with my master's education in University of Alberta, I will send them my certificate and they will now meet that criteria and make me write the RN exams. Yeah.
No, so there's so much to unpack here. So just help our audience to understand. So you're saying you were a nurse in Ghana, you're an instructor, you've taught people, but you needed to get a degree from a Canadian institution in order to work as an RN, right? And
not necessarily to work. In Canada, before you can work as an RN, you need to write the NCLEX exams. Whether to work as an RN or an RPN, you need to write the NCLEX exams. So based on your credentials that you send from Ghana, then they will determine that you meet the criteria. If you have a Canadian education in addition to what you have submitted, that will qualify you to do the RN. Other than that, you have to do the RPN, and later you have to do the RN.
Okay, thanks for clarifying. So right now, what role are you working in? Are you working more as an RPN or aide or?
Okay, so I wrote my RPN exams in May and I passed. So I'm currently practicing as an RPN. Yeah, so currently I'm an RPN. I'm working with Bethany Nursing Home in Ontario, but I was in Edmonton. So I had to move from Edmonton to Ontario to come and then work. But school reopens in September and I have to go back.
Okay, thank you.
To finish my final year. Yeah.
Thank you for sharing that. And I think the whole issue of migrating to pursue higher education is complex. And some people also educate to work. So Angela, do you have anything to add in terms of how easy or how challenging it might be if you do want to pursue advanced degrees after you've migrated? What has your experience been like?
Thank you, Yvonne. So if you come into the UK as a worker, as a nurse, to come and work as a nurse, like Richmond said, you're on a particular kind of visa, and that visa is purposely for you to work. If you decide that you want to go to school, the immigration system is not designed to accommodate that. So if you plan on coming into the UK with the thought of, okay, let me come in, do some work, and then advance, you have to reassess. So first of all, you can, after 3 years being on this work visa, you can do some certificate courses, but for advanced degrees, you are not allowed to. So if you want to do a master's, you're not allowed to do a master's until you've got your indefinite leave to remain, which takes 5 years, assuming everything goes as planned. So in my case, what I did was, so my husband and I, so when we came after a year, he got a work visa and then we swapped. So I became his dependent and then he became the main visa holder. So when you're dependent, you tend to have more, liberty. There are lots of things that you can do, and one of them is to be able to go to school. And that was one of the main reasons why we swapped over. And then when you swap over, the UK resets your time here to 0. So assuming you've been here 3 years and your husband gets a job and you say, oh, actually, my husband is on a work visa now, let's do a swap. They will reset your ILR time to 0. So it means your 5 years starts counting from 0. So we lost a year, which was fine because I really wanted to go back to school. So that's one thing you have to bear in mind. And also when it comes to tuition, even if you're the dependent, fine, you've got the liberty to go to school. The UK still looks at you as an international student, so you will pay international fee. You will not pay a local fee, just so you know. So you pay more than 2 times or sometimes even more than what a local resident pays, even though you're like everyone else here, you're paying your taxes, your NIO and whatnot. And that's another thing to also bear in mind. If you decide to apply for funding, any of these scholarships that are, for minority groups like people from Ghana and the like, there you fall within a gray area. Okay, so here you are as a UK resident, but not really viewed by the UK system as a resident, but viewed internationally as them. So what happened in my case, I was neither qualifying for UK sponsorships, neither was I qualifying for African based sponsorships, because I wasn't viewed as an African resident or a Ghanaian resident. So that's a very that's a very complex aspect to it that people don't know. I've had a lot of nurses reach out to me to ask about that. Yes, you can do some vocational or undergrad certificate courses after I think 3 years, but for a master's you will have to get your ILR first. I just thought I'll throw a light on that.
Thank you so much for that. And Richmond, I saw that you unmuted. I didn't know if you wanted to elaborate on anything Angela just mentioned.
No, what Angela was saying is resonates with me, because when I got here, I was thinking of perhaps I'll do my postgrad at some point, but I realized that it's going to be very challenging for me to get it done. So that's one of the reasons why I relocated, because once you're here, because the scholarship schemes in Ghana are meant to attract, the ones in the UK are meant to attract from sub-Saharan regional Africa, people who are living there. So once you are not living there, you don't get the benefit of applying for those scholarships. And if you live in here, you're considered an international student. So you pay 2 times what the residents pay here. So either you wait your 10 till the 3 years before you get some leeway with the tuition and whatnot. Yeah.
Okay, great. Thanks for clarifying this. Again, there's so much to unpack here. So for any of our listeners or anyone who is attending this webinar today who's considering making this journey, it's good information to have, because it sounds like you can't just move to the UK to work as a nurse and maybe a year later decide I want to, for instance, pursue a master's degree, right? It's actually complex, and it sounds like, Richmond, that's one of the reasons that you decided to leave the UK. So someone actually asked a question earlier that's getting at some of the experiences you had and some of the things that were said to you as you worked as nurses. So I think the question that's coming from Priscilla is, can you share details into how you dealt with what she describes as mental assault and unfriendly welcome and that you may have experienced from people around you, whether it's patients or others? Was there any support group to encourage you and to support you with that transition? So if anyone wants to share what types of supports were available to you as you made that transition, let's say in the first year.
I can take that, Yvonne, if that's okay.
Yes, and then I see, and Daniel also unmuted, please.
Oh, okay. So most NHS trusts and most employers have mental health champions that are supposed to give you support if you're struggling. But what I do find that a lot of the time they don't really understand what your struggles are because they haven't lived your experiences. Once in a while, you will get maybe a union rep that has lived your experiences or understands you more and tend to resonate with where you're coming from. I think from in my own personal experience, I've even had to have counseling where I was having difficulty at work, which sort of merged with my own personal difficulties as well. I had counseling via my general practice and via the GP because in the UK healthcare is free, so you can actually just sign up for Kent's Mind, which is the mental health group that takes care of mental health in this region. And I got a counselor to sort of help me through the difficulties. But I think when it comes to the discrimination and all that, the thing is, for me, I came to realize that it has nothing to do with me. It had to do with the people that behave that way. You will meet people that are very ignorant, people that are very closed. They've never met anyone like you. All they've seen is what they see on TV, and they tend to be very nasty. And sometimes you will realize it's because they're intimidated by you. Okay, you've come in as an HCA, you're aspiring to be a nurse. In their mind, you are not good enough. Why should they be HCA and you come from Africa, and in 6 months, 3 months, whatever the case is, you're a nurse and you're delegating tax for them? It doesn't make them happy. So you just have to about you. It's about them. You have to do a lot of, I mean, when you come to this country, you will learn a lot. And one of them is how to self-care. Okay, you need to be able to take care of yourself, and then you need to also socialize, join groups like GDNA. That's why I'm really happy about GDNA. So you can reach out to people. I have nurses that reach out to me all the time, and because I've walked the walk, I know what might help them, and more or less direct them on where to look for help. So that's how you deal with it. Liaising with like-minded people, signing up for support groups like Kent's Mind, or through your GP, or through your trust, and then a lot of self-care, and you should be fine. It takes time, but you should be fine.
Thank you, Angela. Daniel?
Yeah, so thank you very much. So also want to link the question about the racism and all that, impede promotion as well. So I think, working as a nurse involves a lot of mental toughness. You really have to be tough. And over my, over 30 years experience working as a nurse, I've encountered so many things from racism and all that kind of stuff, but I've never sought help. And I'm not saying that I'm unique, but it's about toughening up. And because what we have to realize is even the other group that we probably consider are racist to us, they also encounter issues whilst working as professional nurses. So we need that mental toughness to actually move on. So yes, everywhere. And let's not forget, in our society, even in Ghana, there's huge kind of discrimination and racism everywhere that you turn, okay? But it's about how do you navigate through this? And in terms of promotion, usually, yes, racism and all that, counts when it comes to job promotion, but I find the most important point here is culture, okay? You immersing yourself in the culture where you work. If you go and isolate yourself and decide not to move with the people, then I'm afraid you're not going to get promotion. So from experience, and what I used to tell nurses that migrated to Ghana was to go with the flow. Okay, if you're ward, if they're going out to a pub or to have drinks, go with them. Don't say, oh, I don't drink, I'm a Christian, I don't smoke, I'm a Christian, so I'm not going with them. Well, if you don't go with them, that means you are not immersing yourself in the culture. And that means you're seen as a different entity altogether, and promotion wouldn't come your way.
Okay, thank you. And I see Mrs. Nugent has her hand raised. And I know the GNA in the UK has done some work in terms of supporting nurses who make that journey to the UK. So Martha, would you like to follow up on that comment? You're muted if you are trying to talk.
Yes. Yes, I have a lot of comments to make about the questions that are being asked. Yes, there is discrimination, but nurses, we've been blessed with spirit of resilience, because if you listen to your colleagues on the ward, you will never move on. You just have to make the patient your priority, practice effectively, and make your colleagues know that you know what you're about. But some of the hurtful things that your colleagues will say are things like, I thought you were trained in your own country. How come you don't know this? Just let them understand that we are not used to the gadgets as they are in this country. Years ago, those of us who came did not have any support. But one advantage that we had was whichever trust you worked in will support you if you wanted to do your diploma and your degree. Personally, both were paid for. I didn't have to pay a penny. The trust paid for me. Now, things are moving on. The Florence Nightingale Royal College of Nurses, NHS England have identified that we encounter problems. So we have been granted funding to support internationally educated nurses, support them to integrate into the British society and the British way of working, nurture them, coach them, and seek their well-being. So what I'm asking nurses coming in to do is to contact the Ghana Nurses Association for support. Because when you first come in, you cannot do it alone. You need someone to buddy you. You need someone to help you integrate into practices in this country. And that's the message I have to you. We have a number, go on our website. Anyone who comes in and would like support. The problem we're having is Ghanaian nurses do not engage. They only engage with you when they have a problem. But sometimes you don't wait for a problem before you seek help. Again, when they first come in, they should join the union, because if you join the union after you've had a problem at work, the union will not support you. So that is my advice. There is help for nurses coming in.
Great, thank you for sharing that. So you heard from Mrs. Nugent. So if you are making that journey to the UK, the Ghana Nurses Association in the UK has a pastoral care program that provides support, and support structures like that are needed, not just in the UK, but in the US, Canada, and elsewhere to help nurses to integrate into the new society and provide additional support. So thank you for raising that. So I also want to make sure that I'm being sensitive to the questions that are coming through in the chat. Damilola actually wanted to, first she thanked us for this session, but wanted to clarify the comment about education. I think Faisal was talking about the need to obtain an additional degree in Canada, but it sounds like from her perspective, it also depends on the province that you live in and your unique situation. So in a few minutes, we'll transition to Q&A, and I'm sure people like Damilola and others may have insights to share. So thank you for that comment and that question. So over the next few minutes, I just wanted us to talk about, what advice you may have, right? So I imagine that there may be people here who are considering migrating. So can you quickly share any advice in terms of how they can adequately prepare for that journey? So I'll first start with Faisal, and then I'll call on Richmond next. Faisal?
Okay. Yeah, thank you. But I'd say I have a few points to make here. The first will depend on whatever that is bringing the person to the States or to UK. If it is for job, then you need to know that, I mean, mostly before you immigrate from Ghana to UK, if it is through job or career, mostly you have it before you even immigrate to or migrate to UK. But if you want to come to Canada, because I am in Canada, and mostly it is easier to get to Canada through education or through school. And if you want to come to school, you need to have adequate or proper planning, at least 3 months of rent plus feeding fee, because sometimes it takes a while before you get a job to do, depending on the province that you are. Especially if you're in a province like Alberta, it takes quite some difficult time before you get work to do. Then you need to also link with people who are already pursuing your career or who share a similar dream of yours. If you end up staying with somebody who came to Canada and did not pursue maybe educational goal, you are likely to be influenced negatively to start working, and then maybe when you receive your first salary, you just say to yourself, let me convert it to Ghana cedis. It is this one. I think I'll be okay. You are content with it, and that is all. So you need to link with people who are already pursuing your career. And then another important thing is that if you came with the purpose of coming to school, go to school. Some people come here with the intention, they come with admission, they are being admitted, and they have student visa. They come here, people will tell them, go get someone to marry, pay this amount of money, blah, 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 so that you get your PR. One good thing about Canada is that if you come here as a student nurse, I mean, there are several opportunities here for you. Yeah, just to clarify the difference between Canada and UK. In UK, if I move from Ghana to UK with my diploma, and then I write the CBT and the OSCE, I can easily become the RN. But same cannot be said about Canada. Yeah, you need to get a Canadian education, and then you need to write the NCLEX. So that is, I mean, the clarity that I want to quickly make over there. Bring a lot of clothing. And then I remember one funny thing is that I came with my Technophone. I went to get a SIM on it. They tried, and so at the point, the lady asked me, "What type of phone is this?" And Bernard was there, and he said, "Please, it won't work." So I mean, come with either Samsung phone or iPhone when you actually want to come to Canada, and be prepared for the weather, because the weather is not friendly at all.
Thank you, Faisal. Okay, Richmond, any advice for people who are contemplating making that journey? You're muted, Richmond.
In as much as the trust is interviewing you, you should also take time to interview them and interrogate what their turnovers are, the number of Africans in their trust, and how long do they stay. Because one thing I found when working in the UK is that there are some places that African trained nurses haven't worked there before. So sometimes it turns out that you'll be the first person from Africa directly working there. So you have to be, you will be dealing with a lot of issues. Fortunately for me, I had a nurse who had been in the UK for 17 years working in my unit. So most of the things that they were doing that was not right, she will advise me on what to do, and sometimes she will step in for me. So it's very good that you ask your employers these questions as well. And secondly, as Ghanaians, we tend to have the idea that the hierarchy of age, when we kind of respect the elderly, but at some point you need to be able to have the courage to tell someone off when they step out of the line, else you're going to be at the receiving end of these treatments. So sometimes you need the courage to get some things out of your chest. It helps.
Well, it sounds like Richmond is encouraging us to be assertive, and you know, in terms of our culture, yeah, I couldn't agree more that sometimes it's hard to speak up, but Richmond is encouraging us to be assertive. So, Daniel, any advice, Dr. Apau, any advice for our audience?
Yes, sure. I think we've had a few questions in there about how to prepare, you know, being a UK nurse, you want to move to the US. This is a very, very interesting subject and one of my favorites, okay? Because the National Council of State Boards of Nursing, actually, they start from them from January to March this year, shows that for the UK trained, for the US trained nurses, 57 of them did the exams, and the first time 80% passed. The retest 41% passed. But when it comes to internationally trained nurses, out of 22,000, only 40% passed the first time. And the reason for this is obviously the way the curriculum is structured. One is different, and secondly, the nursing culture is also different. So because of the healthcare delivery, so one really has to prepare, because here the NCLEX is mainly on delegation, assignments, prioritization, right? Which doesn't usually happen a lot in the UK, like overtly. Even though you do it in the UK, it's not very overt in the UK, because the exam will test you as if you have the patient that you need to discharge, okay? Who is going to go and do the discharge? Who is going to go and do the education for the patient? Okay, how do you delegate? Okay, and what does delegation mean? So this is where the NCLEX usually will want to find out. And one of the things that I had to do preparing to come over here is to go over all that, because here in the US, we have the CNAs, or equivalent to healthcare assistants in the UK. And there are certain things that you cannot let them do. And there's a simple thing that you cannot delegate what you can't eat, and what you can't eat, as in EAT, evaluation, assessment, and teaching. None of this should be delegated to the CNA. So in the exam, if you ask a question about, oh, your patient says the wound is leaking, and you send a healthcare assistant to go and educate the patient. No, you don't. You have to go and do that, because the moment you send the healthcare assistant, you're going to fail that question. So it's about preparation. So that one is very, very important. And also, before you can, register for nursing board, and then you get the permission to test for the NCLEX, they need to make sure that your educational qualifications are obviously okay. So you have to go through the CGF, and that was my nightmare trying to come over to the US. But you need to make sure that your transcripts really match the required hours, okay, stipulated by the nursing board. And it's very, very easy. You can go to the internet and find out, because they need to make sure that you've done some hours in community, some hours in pediatrics, some hours in obs and gynae ward, some hours in mental health, But in the UK, for example, all that is done. So when you train in the UK, your transcripts really should be okay. But it's more about how do you write the NCLEX, and that is the most important thing. You really need to get a book, or you can go to some of these websites and practice, because some of the things obviously you'll be required to know is not very, very open in the UK. Right. And that is your first step. You need to prepare. Otherwise, I'm afraid you're not going to pass first time with the NCLEX.
Great. No, thank you for those excellent insights. And there are additional questions for our panelists in the chat about your unique experiences on the NCLEX. So if you have a moment, you can respond to them. So Mrs. Nugent, what advice would you have for our audience in terms of making that journey?
Preparation. It takes a lot of commitment to leave your home country, no matter how bad things are in your home country. And it takes a lot of sacrifice to move into another country. So my advice to my brothers and sisters who are hoping to come to the United Kingdom, as Daniel has advised, warm clothing is very, very important to make sure you have. money for your rent, because the nurses who are coming in are being given nurses accommodation for a month. A week to the month, you are asked to find your own accommodation. Most of them do not have the money to go and rent expensive accommodation in this country. And that has become a problem for our newly educated nurses who are arriving in the United Kingdom. So you need some money put aside for all these contingencies before you make a move. Secondly, when you go on a ward, I know some of us do not want to affiliate with our Ghanaian colleagues because of what we are told when we are coming into the country. Don't affiliate yourself with Ghanaians. They are worse than the white people. That is wrong. Just find someone that you can communicate with. Let the person know what your needs are. And I always advise that when you come in and you're asked to undertake a task, do tell the person asking you to undertake the task that you do not feel confident or competent to undertake the task. So you can humbly request for that person to assess you or do it for you to observe, and then you do it for her to assess you and deem you competent before you go on to undertake a task.
Right.
Yes.
Absolutely.
And when you come in, you have to join some Ghanaian associations for you to get support. There is nothing like having someone who understands your culture.
Yeah, absolutely. Couldn't agree more, Mrs. Nugent. Thank you so much. So, Angela, you'll have the last word before we throw things or give an opportunity for our audience to ask questions. So, what advice would you have?
I would say if you're a nurse in Ghana and you want to move abroad, don't do it just because people are doing it. You have to assess your own situation. Moving abroad as a single.
I think we lost Angela's audio, but I imagine she'll reconnect in just a moment. So while we wait for Angela to come back on, I think one thing that is on my mind is what can be better done to help prepare nurses who want to migrate or have migrated. So when we think about, the support structures and policy changes that are needed, well, what can be better done to help nurses with this transition? So this question, anyone of our panelists can answer this question in terms of what we can do to better support in terms of the employers, right? There are agencies that recruit these nurses. What can they do better to support nurses during this transition? And policymakers, right? Should we just allow any and everybody to recruit nurses from Ghana and not, provide the necessary support? So who would like to take that on? I see Daniel, please.
Okay, so this is a very, very important, aspect of transitioning, newly migrated nurses into the system. And when, mass migration started, there were policies in place because these nurses were given at least 6 months orientation. And part of the orientation, there was a huge element of cultural orientation. Because if you imagine somebody, arriving from Ghana straight to the UK, sometimes, they don't even know, how to say, I'm sorry to say, but sometimes in Ghana, they say, yes, please, no, please, that kind of stuff. It doesn't exist in the UK, okay? You have to train them all these fundamentals, and that is very, very important. So most of the agencies actually do run this cultural orientation for newly migrated nurses. So if you going for an agency, I think Bongi stated in there, putting a message in there that if you going for an agency, ask questions, okay? If somebody wants to employ you, ask questions. What kind of support do you provide? Okay, what kind of orientation do you provide? You need to be assimilated into the system. They can't just throw you at the deep end because, hey, I always say, if you come abroad, okay, and you know someone, it's like you spend 10 years over there because that person teaches you a lot of things that you probably wouldn't get. And that is exactly what you need if somebody is bringing you over here. I mean, I said, I lived in the UK for about 30 years, right? I came to the US, still a new kind of culture shock to me as well. Okay, so you always need to have somebody to orient you. And if you haven't got that in your package, please think twice before you move.
Great advice, great advice. So ask questions, look at the contract, and we'll get into it because sometimes, there's this question of people are asked to sign contracts, and when they're working and they recognize that the environment is not safe and they want to leave, sometimes there are threats that are made. And so it's important that people are aware of resources that exist and making sure that they're protecting their interests as well. So Richmond, I don't know if you also were going to jump in terms of what can be done to better support nurses during this transition, and then Angela.
I think that with the employers, they need to, sometimes they tell you, one of the things that these nurses look at is the salary, like the annual gross salary, but it needs to be put in context, like the rent in that area, the council tax, because they sell you get people telling you, this is the annual you'll be making without any context to it, whether you're spending half of your monthly salary servicing rent. So all these things need to be told to the nurses. And also there has to be avenues for people to kind of be able to address issues with contracts and stuff, because with the contract, especially, it's more prevalent for people moving to the US than in the UK, because in the UK, most of the people moving are directly through the hospital, very few agencies. Most of them do it through the trust. But with the US, you have a third party playing the middle role. And sometimes one of the things they do is that the nurses are the employee of the third party, not the hospital. So basically, they get the full salary from the hospital, and they pay a bit to the nurses. So basically, before your contract ends, they would have siphoned a lot of money from you. So people need to be aware of that as well.
Mm-hmm. Mm-hmm. Yeah, great advice. And I also see in the chat people, chiming in about the cost of living. So what you're highlighting is that when you're told what your salary is going to be, in addition to calculating the equivalent in Ghana cedis, also do your research and figure out, what is the cost of living in that area so that you are also better prepared. Thank you. And does anyone else have anything to add in terms of what can be done to better prepare? Yes, Mrs. Nugent.
Another advice is that before you accept to go with an agency, you must research that agency, what they do for nurses. You must find a nurse who has been brought in by that particular agency and what they have done for them. Because some of the agencies are very good. They bring in the nurses, they give them accommodation, they support them to settle in. And the nurses do settle in very well, but some of them do struggle. So the agencies that are bringing in the nurses need to know them well before they accept or before they pay monies for them to bring them in. I think it's important.
Great, thank you. Angela, and then we'll open it up to the audience. If you have a comment or a question, please use the raise hand feature and we'll give you permission to talk and ask your question. So Angela.
Thank you, Yvonne. Sorry I froze earlier. My internet froze. Yeah, so you were asking of advice. What I was saying was if you're wanting to travel abroad to the UK or wherever, don't do it because everyone else is doing it. Everybody's situation is different. Some people come here as singles, some come as married but without kids, some come married but with kids. It could be one or two, three children, and each case more or less determines how hard or complex or how easy it will be for you to be able to settle in. So assess your own situation, reach out to someone who probably is here longer and is going to be very open to you. I mean, reach out to organizations like Auntie Martha's, or you can reach out to anybody in GDNA, and then we can give you the facts. Okay, it would not. There's no need to sugarcoat anything. I for one, if I have a nurse that reaches out, I tell them exactly what it is. It's very expensive, and I mean in the NHS, we all know there are strikes upon strikes. It's all over, and there is a reason for the strike. Okay, people are not striking just because they want to strike. So if you're coming in here and you're coming into the system, you have to know what to expect in terms of preparedness. I think, like Richmond was talking about, employers letting nurses know what they're coming in to face. I think we have to understand that the position of the employer is very different from the position of the nurse coming in. The employer wants to fill a vacancy. Okay. If they are a private provider, they are profit driven. They want to make money. If you come in, you're going to make money for them. So they are not going to tell you what your challenges are going to be. It's the onus is on you to make sure you're making the best decision for yourself. Okay. So if you're coming in, you want to explore I'm coming with two children. What am I going to do with childcare? I mean, the visa you're coming on, there are so many restrictions.
Right.
There are so many restrictions until you get your ILR. So yes, there's free this and free that, but it does not apply to you. So these are some of the things that you really need to dissect before you come in with your family of four, three, two, whatever the case is, and your spouse. You will find nurses that have spouses that have very good jobs back home. They leave their jobs, come in, and they cannot find anything they desire to do here. They end up being ACAs. And look, these are some of the real issues that put strain on people's, marriages and love life and mental health. And these things happen maybe 6, 7 times out of 10. Because due to a banker comes in here, cannot find a banking job, and has to end up as an HCA. And we all know what that means for a lot of people's ego. So please do the due diligence. No employer will do that for you. Reach out, speak to people. Let us tell you as it is and make an informed choice. Thank you.
Great. Thank you. Thank you so much. So I see Brenda, you had your hand raised to ask a question or to talk. Are you able to?
Hello.
Yes. Can hear you.
Hi. My name is Brenda. I'm a nurse in the UK. I work in primary care. This is very, very interesting. Well done to you guys. I mean, as all of you have said, it's so true. I moved here at the age of 16, so over 20 years ago, and I've worked in the NHS system for quite a long time. I do agree, yes, people need to do their due diligence when they come in. And also, as somebody said, nurses, Ghanaian nurses especially, they don't want to integrate with the system. I mean, as I said, I came here quite young, so it was quite easy for me to adapt and move on and things like that. But when you do see nurses immigrate to the country, they're not really willing to, and they expect, yes, this, I get the auntie business, but, we need to move on from that, It took me near over 10 years to be able to speak to a healthcare assistant who is probably old enough to be my grandmother, call them by their first name. It's a culture shock. I get that, So, I mean, yes, it is hard. when you come in and you're training, yes, as Dr. Daniel said, you can, if you don't put yourself out there, you will not get the progression. You know, if you're not willing to move and get up and do the odd jobs here and there. You know, COVID came, I worked as a COVID nurse. I was swabbing in care homes. The things I saw, and I would never like to see them again. But at the end of the day, we've done it, you know. And yes, for me, I came into nursing because my dad died at 48 of a heart attack in Ghana. You know, it was it was very sad. So that was my calling to nursing. But every contact I make with a patient, I tell myself I'd like my family relative to be taken care of the same way. And that's what I walk with, you know.
Right.
So that's my little contribution.
Thank you so much, Brenda, and thanks for attending, and thanks for sharing your story as well.
Thanks.
So I see Martha Dia has her hand raised, and Sandra. Yes, Martha.
Right, thank you. Thank you, Yvonne. And thank you to the whole panel, because you've touched on a lot of things that we as internationally educated nurses, the challenges that we face when we come to this country. I came here, I was trained as a registered nurse and a midwife back home in Ghana, and I have to join NHS when I came here. My simple thing that I want to tell people who are migrating is that we have to brace ourselves for a positive change, right? Especially those agencies that are bringing them here, those that are exploiting them. What they tell them is that don't talk to any Ghanaian. Yes, because they don't want any Ghanaian to give you any advice. So they advise them not to discuss your business with Ghanaians. And as a Ghanaians, that is why we are facing these challenges alone. There is a support available. GNA are supporting a lot of the international educated nurses. So my only advice is that those who here in the country, just reach out to Ghanaian Nurses Association UK for the support. Ask questions. What do I have to do? Whom should I contact? And those of us who are also here, we have stayed in the band 5 for a very long time, 15 years, 20 years. We are still band 5. Why? Because we don't really reach out for mentors. We've got some Ghanaian nurses who can mentor us. We've got some Ghanaian nurses who can coach us. Why can't we reach for them? We are just in our little corner, then band 5 for 20 years. Oh, I'm happy with where I am. I'm happy with that. It's about time we have to move on. We have to have the confidence. We have to step out of authority and be the Ghanaian nurses and face that challenge. We can do a lot more than what we are doing now. Thank you.
Thank you. Thank you so much. We can definitely live up to, our highest potential. So mentorship is something that Martha has highlighted. So Dr. Apau, and I think we'll take a comment from Sandra.
Yeah, thank you very much. And Martha, you've touched on a very, very, very important issue. That definitely was my experience, as a nurse manager in the UK, where Ghanaian nurses come in and they're happy to be a band 5 nurse, whereas some of our colleagues from other African countries are moving forward. And when I was the director of the Advanced Nurse Practice Program at City University as well, the same thing happened. I was trying to encourage these Ghanaian nurses to come and do their nurse practitioner programs. No, they don't want to pursue the education. Please, 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 let's get together and let's move, because everywhere that we go, when we compare ourselves to the other country that I mentioned not long ago, we are way behind. We really need to move on. We need to move on, because there's so much. You become a nurse practitioner in the UK, okay? You have your own enterprise, and you'll be making a lot more than what you think you're making at band 5 comfortably. So please, let's talk to each other and let's move on. Education is important. Absolutely.
We should all embrace opportunities to advance. Comment from Sandra.
Hello.
Yes.
So my name is Sandra. I'm a registered nurse from UK here. I was previously working in Kolebu, then decided in 2020 to just move away and just move to the UK. I think my experience so far has been very different from what I've heard everyone say, because one thing that really helped me was I had a good mentor right from when I was in Ghana. Because I remember when I was applying for job, so I have like one of my mentors, she was already here in UK. She's one of the members of GDNA, and she works in Cambridge. So every time, she's a member of the Ghana UK Nurse Association. Yeah, that's it. Every time she'll be like, oh, Sandra, if they give you a job in DME, although you're desperate to come, don't accept it. Look for a specialty that you're interested in and go for it. Then I told her, I'm really interested in cancer care and I'm really interested in ICU. And she was like, yeah, get some, although as you're working in Kolebu, just volunteer, move to the world, get the experience and tailor your CV towards that, which I found really, really helpful. So I know getting the job is very, very difficult, but it's for me, I found myself working in specialty area really helped me. So when I moved to the UK, I still kept contact with her. And the first thing she told me was, this is your diploma, you need to do your degree. And at that point, I was really, really interested in doing agency. And I knew that doing my degree at that point, I won't be able to do agency. But she was like, don't worry about the money will come at the right time. Then I did my degree, finished my degree. And every time she sees me, she'll be like, why are you still wearing this Band 5 uniform? You need to do your advanced practice. You need to move into advanced practice nurse. And I was really, really skeptical about moving. And at that point, I had this very big imposter syndrome. I was like, oh my God, will I be able to do this? Oh my God, will I be able to do this? But funny enough, I spoke to my manager and she was like, yeah, you have the experience to do that. Apply to the school and we'll apply for funding. And you go for the panel interviews and just prove to them that you are qualified to do that, which I'm very, very grateful I did. And I'm currently doing my advanced nurse practitioner master's in cancer care. I think for me, what really helped me in terms of the mentorship was, it also helped me to like how I'll portray myself. When I meet someone friends, they'll be like, oh, when I'm at the ward, I'm told to do this. I was like, oh my God, I've never experienced this. Because when I started the job, I was told, you need to devote your personal time into studying. You have to know your stuff. You have to know your policies. You have to know the protocol that works at the place you find yourself in, which sincerely, I really devoted my personal time to do all this. So it made me blending into the system very quickly, like very easily. And I really struggled when it comes to opening up and socializing with my colleagues. And I think the agency I came with, they are also really, really good, because I remember when I started the job, every 3 months, they just check up on me and message the manager just to know how I'm getting up with work. I think the first feedback my manager gave them was, oh, she's very good, but she finds communication with colleagues very bad, because back home, I can't call my manager back home by her name. But here, if I call her, oh, sister, she finds it very weird. And you know how they were like, oh, let's go out for drink, let's go out for this. And my mind is like, oh my God, I need to mind, like back home. Some people say, oh, just mind your business. You need to work, enter at work. Don't go anywhere with those people. So I think, although I think Dr. Daniel spoke about this before, at least once in a while, you could hang out with them, because that is when you know what's happening.
Right.
Any job that will come out, we discuss it in the pub first before the job comes out.
Wow.
And we discuss who is applying for it, and we discuss who gets it before the job comes out. So I think we need to also try to know how to blend in, communicate with colleagues. And recently, trust I'm working with, they're beginning to recognize the previous experience of nurses, because I know some nurses that have recently come from Ghana that they are paid. They are not starting them from like the lowest Band 5. A lot of them, they're paying them from the highest Band 5. I think so when you're applying for a job, you need to at least ask questions, try to bargain for your salary, try to tell them your experience and see if you'll be able to have some pay increment in terms of your previous experience, because some of the NHS trusts are beginning to recognize that.
Thank you so much, Sandra.
Yeah.
You've imparted so much wisdom and advice and guidance. So Thank you so much. And your point about mentorship is also well taken. And that's why GDNA is developing a mentorship program to support nurses who are making this transition. So thank you. So we want to hear from all our attendees today. So please take a moment to evaluate the webinar. I know our time is up. We want to be respectful of everyone's time. So please, if you're not yet a member, please join GDNA is g-dna.org. We have committees that are working on a number of issues, including how we can support the professional development of nurses in Ghana and in the diaspora. You could be a mentor to a nurse who is making that transition. You can support us in our efforts to write grants, and you can also stay connected with us on social media. We are on Twitter, Facebook, LinkedIn, you name it. We also have a Telegram account, and we will be sharing the information with our members. So in closing, we just want to say, first of all, thank you so much to our panelists for taking time out of your hectic schedules to share your experiences with our attendees today. We value and appreciate your expertise. And we also want to say thank you so much to the over 190 participants who joined on today's webinar. Thank you for taking time to participate. And if you have additional questions, feel free to engage with us. You can send us an email if you want to connect with any of our panelists today. They'll put their contact information too if you want to connect or ask any follow-up questions. So with that, we say thank you, be well, and we will be offering additional webinars covering different topics. So thank you so much for your time. Thank you.
Thank you.